Preventing infection in the clinic. Clean clinic practices prevent infection in clients and in health workers. To protect yourself and clients in your care from harmful germs, follow infection prevention practices. This video will show an overview of basic practices to prevent infection in clinic settings. Cleaning hands is the single most effective way of preventing infection. Use an alcohol-based hand rub routinely unless your hands are visibly dirty. Use the same method as hand washing over 20 to 30 seconds. If your hands are visibly dirty, or after using the toilet, wash your hands using clean running water and soap for 40 to 60 seconds. Rub your hands together to cover all surfaces. Rub palm to palm. Then weave your fingers together each and every way. Rub the backs of your fingers on your palms. Rub your thumbs. And rub your fingers on your palms. Then rinse with clean running water. And dry your hands in the air. Remember, gloves can have tiny holes that can let in germs. Even if you wear gloves, clean your hands at these 5 moments. Before touching a client, before a clean or sterile procedure, such as inserting an implant, after touching a client, after being exposed to blood or body fluids, such as after an IUD insertion, and after touching the client's surroundings. Put on sterile gloves correctly. First, open the sterile pack, taking care not to touch the gloves with your hands. With your non-dominant hand, pick up the edge of the inside cuff of your dominant hand glove. Touch only the inside of the cuff. Slide your hand inside, finding the openings to the thumb and fingers. Slide your fingers and hand into the glove while you pull the cuff over your wrist. To put the second glove on, put your gloved fingers into the cuff of the other glove. Slide your fingers and hand into the glove, keeping your hand flat with your palm facing up. Once both gloves are on, then adjust them. To remove the gloves, grab the outside of one glove with the other hand and slowly pull it off, allowing it to fold inside out. Gather that glove up in your other hand, then slide your thumb under the other cuff and fold it inside out. This way, you never touch the outside of the gloves. Protect the woman. Prevent germs from entering her body during procedures. For example, when inserting an IUD, follow these no-touch practices. First, be sure all instruments or devices that enter the woman's uterus are sterile or high-level disinfected. Second, clean the cervix with antiseptic using a circular motion from the center outward. Use a separate swab each time. Third, don't let instruments that will enter the uterus touch anything but the cervix. The end of the instrument should never touch unsterile parts of the tray, your gloved hands, the woman's skin, or her vagina. Protect yourself from contact with blood, body fluids, or chemicals. Wear clean exam gloves whenever you touch any blood or body fluid. For example, when you do a vaginal exam. Wear thicker gloves for cleaning instruments, exam tables, and floors. Wear goggles, a mask, gloves, and a long apron made of waterproof material if you may be exposed to splashing blood, body fluids, or chemicals. Clean the clinic environment. Use chlorine solution to clean surfaces after each client. Use soapy water to clean floors at the end of the day or as needed if it becomes soiled. Wash soiled sheets with soap and water. Rinse them and hang them in the sun until they are fully dried. Clean and high-level disinfect or sterilize all instruments used during a procedure. Soak them immediately after use in water until you are able to clean and reprocess them. Then high-level disinfect or sterilize the instruments. Store them wrapped in sterile packs or in drums. Safely dispose of waste. After a sharp object such as a needle has been used, it is contaminated with germs and can easily pass infection to others through a jab. Drop the needle directly into a puncture-resistant container after use. Burn sharps containers, as well as any infectious waste, in a high-heat incinerator. This is the best choice. If that's not possible, another good option is to bury waste in a covered pit, protected by a fence and away from water sources. Remember, clean hands prevent infection. Protect yourself with gloves, protective clothing, following safe cleaning practices, and disposing of waste safely. Protect your client with clean hands, clean surfaces, and reprocessing instruments.